Megaloblastic.
It's a fun word.
It reminds me of like isn't there some sort of like an undersea creature that's a megalo something or other? Giant whale, megalo, anyways.
It sounds like a cartoon character.
Hi, Tina.
Hello, Leah.
We're talking about B12 today, aren't we?
Yes.
I should sound more enthusiastic, but
yeah.
through my research, through my falling down the rabbit hole, I realized I don't like B12. It's too much.
It's too much. It's too complicated.
It's too complicated.
It's definitely the most complicated B vitamin, I think.
And, it's one of those things where people are like, oh, just take B12. You'll just pee it out. No, don't do that. You don't just pee it out. I mean, you do pee it out, but...
You do pee it out, it's true. But you also store it. And you may use it. But here's the thing. So in the grand scheme of things, generally speaking, I think B12 has gone under the why not take more? There's no toxic levels idea of nutritional supplementations. But within cancer care, that may not be true.
Right.
That's where we run into the, oh man, come on. Can anything be simple?
That's why I'm just like, this is too complicated.
All right, well, let's just untangle it. If it's complicated, let's make it simple, or at least simple enough to make it useful information and...
hopefully not confuse all the people out there.
No. We're going to make it simple. We're going to have take-home points. If this, then that. Always, never, those kind of things.
Oh, yeah, totally. That's what we're going to do today. All right, so today on the Cancer Pod, we're talking B12. What is it? Where does it come from? Why do we need it? Stay tuned.
All that and more.
All that and more on this episode of the Cancer Pod.
I'm Dr. Tina Kaiser, and as Leah likes to say, I'm the sciencey one.
And I'm Dr. Leah Sherman, and I'm the Cancer Insider.
And we're two naturopathic doctors who practice integrative cancer care.
But we're not your doctors.
This is for education, entertainment, and informational purposes only.
Do not apply any of this information without first speaking to your doctor.
The views and opinions expressed on this podcast by the hosts and their guests are solely their own.
Welcome to the Cancer Pod.
Let's talk B12.
Let's talk B12. Sorry, I didn't mean to cough. I was just like on our break. I'm like, should I address my cough? And then I'm like, I had the flu. Y'all. I caught the flu New Year's Day at a football game, indoors at Lambeau. I didn't wear a mask. And it's been like, this is 3 weeks.
Yeah. Well, yeah, it's getting there.
Well, almost 3 weeks. And I have this lingering cough. So don't get the flu, y'all. It sucks.
No, but that does remind me of what I said to you yesterday, which was a cough that doesn't resolve. You need to get a chest x-ray. So if it keeps up, you got to check it out. Make sure there's nothing deeper.
I know.
All right. As long as we're clear.
Yes, doctor. I'm going to drink my tea.
All right. Back on topic. We're going to talk about B12.
B12. We're talking about B12 today.
Also known as cobalamin. So I'm just going to geek out for a moment. So at the heart of every B12 molecule, I don't care which one it is, there's all sorts of versions that people can take as a supplement, and there's a couple versions that we make in our body. If it's B12, at the heart of it is a cobalt molecule, like cobalt, like the stuff we use for batteries. I'm just going to say that because I think it's a cool little factoid.
Can you hear that's Chloe boofing?
What's she woofing about?
I don't know.
I think she's excited about my point.
I think that she is frustrated with B12 like I am. What the woof?
All right, so we're going to talk about deficiencies. We're going to talk about high levels. We're going to talk about what makes people prone to having a deficiency and how they can rectify that safely.
Right, because there are medications that people take on a day-to-day basis that can lead to B12 deficiencies. And yeah, that's like outside of like the whole I'm being treated for cancer world as well. So in my vast research, I learned that vitamin B12 was first, I guess, discovered or isolated in the 40s, in 1948, which I thought was interesting. Because it's really not that long ago.
No, but we were discovering vitamins kind of fast and furious during the 40s there. It's one of those vitamins that we were repleting people with before we knew we were doing it, because there was, in the early 1900s, and maybe probably in the 1800s as well, there was observation by doctors would lead to this diagnosis of a particular type of anemia, and they would give liver extract in injectable form, and they would actually inject people with liver extract that was isolated from animals.
Wait, like in their blood inject?
Into their muscle, usually. Mm-hmm.
Oh, well, yeah, because you're supposed to, B12 is only supposed to be done through muscle.
Yeah. They had no idea that it was B12 in the liver extract that they were giving. I'm always fascinated by this kind of medical stuff that happened over time and observation. This is long before we had evidence-based medicine. We just had case series observations. Doctors would write those observations up, and that's how medical information was shared. There was no established kind of, double-blind, placebo-controlled trials going on at that time.
And since the liver is where B12 is stored, one of the places where B12 is stored, it kind of makes a lot of sense. I wonder why they started using, was it just like some random, let's just grab some liver extract and inject? That's just so crazy that people come up with something like that.
Well, it was a time when doctors would do more of the art of medicine, which involved just observation and going from there. And so my guess is it was back in the day when if there was trouble with an organ, you would give that organ from the animal. So when people had trouble with their liver, and the doctor probably said, okay, this is why I think you have trouble with your liver. Let's give you liver extract. Someone who has trouble with their kidneys by the assessment of the doctor. And that might involve looking at their blood. It might involve looking at their skin, their hair, their nails, and taking their symptomology into effect, looking at their urine, actually smelling their urine, seeing what color it is, everything, and say, oh, there's something wrong with your kidneys. Let's give you kidney extract. And so that was pretty common back in the day. So I'm guessing that's how it evolved, the liver extract, but I don't know. I have never looked at how it came about.
Well, we're going to have to go back down that rabbit hole, aren't we?
Yeah. There are so many.
There's a lot. There are a lot with B12.
Because it's super interesting. That's why, I think.
Yeah. So just a quick review as to why somebody would use a supplement over food. I guess that would be really relevant for this because people who eat vegan diets aren't really getting B12.
Yes. Although, here's the thing. In nature, every molecule has to be produced, right? Every molecule has to be produced from the elements that we have, mostly in our soil, some in our air, but mostly our soil. And so the bacteria themselves are what create B12. Bacteria puts together these molecules of cobalamin from the elements in the soil. And sometimes they do it together with plants. So there's a symbiosis going on there. But ultimately, bacteria, or organisms, I should say, because there might be some others besides bacteria. Maybe there's some yeast that can do it. I don't know. But technically, if vegans could get enough of the bacteria that makes it, they might be able to be replete. I haven't seen any studies to that effect, but I mean, theoretically, they could eat bacteria and get it in fermented foods and cultured foods if those were purposely made.
If it's the right kind, if it was the right kind of bacteria. But alas, they supplement because of the problems of not having enough B12.
Yes.
So that would be the way to kind of prevent or treat an acute nutrient deficiency of B12, which can cause neurological issues, is the big one with a B12 deficiency.
Yeah. And this is why, sublingual B12 is the way to take any B12 supplement. We'll talk about forms in a little bit, like the different forms of vitamin B12 or cobalamin. But sublingual is ideal because it bypasses any problems that could be happening in the body with absorption. So when you do it sublingual, it goes directly into the bloodstream rather than through your gastrointestinal tract.
So the other reason why we use supplements in general is to prevent, delay, or treat chronic nutrient deficiencies. And with B12, that could be like somebody with pernicious anemia. And then the green pharmacy usage for B12. Oh, there's so many. Are you frozen?
No, I'm thinking.
Oh.
I'm in deep thought.
So, I mean, I think the green pharmacy thing is kind of more what people take for themselves as opposed to like what something we would recommend for. So people, you get patients coming in and they're taking B12 because they're tired. And somebody said, oh, you should be taking B12 because it gives you energy. Or if they have any sort of neuropathy, they might take it. There are different thoughts why people would take B12 as a supplement.
And I'm thinking about our colleagues. I know that there have been times that people will do injectable B12. So it's high doses of B12, intentionally megadosing it, like green pharmacy style, as an antiviral.
Oh, really?
Yeah.
Hmm.
Yeah, it has been used in that sense, especially when it comes to things like shingles or that herpes family of viruses.
Oh,
So,
interesting.
yeah.
Yeah, because isn't like there are the B vitamins for treating post-herpetic neuralgia, I think.
Mm-hmm.
And what's the other one?
Bell's palsy?
Bell's palsy is the other one I think of. Yeah, okay.
Yeah, that's the other time I've seen it used.
Yeah, it's been a while.
I would call that green pharmacy because you're using megadoses.
Yeah, totally. Right. And I guess green pharmacy, would that be the repleting what certain medications would be depleting? No, that would be preventing, delaying, or treating chronic nutrient deficiency. That would be number 2.
Mm-hmm.
Because, yeah, there are medications that can interact with the absorption of B12, like proton pump inhibitors or H2 blockers, things that people take for acid reflux or GERD,
Mm-hmm.
because you need stomach acid in order to break apart the B12 that comes from food. And those medications decrease your stomach acid.
Yeah, so maybe we can take a break. Let's come back and talk about exactly how it is absorbed and who is vulnerable to B12 deficiency after the break. All right, we're back. So continuing on with the medications that could cause B12 deficiency. What else is there?
Yeah. Metformin, I think, is a really, I mean, there are others. There's like colchicine and stuff like that. You know, people aren't taking these on a regular basis, but metformin is another really big one where, because of the way that it's affecting the absorption in the small intestine.
Well, that's a big one because metformin is used off-label within cancer care as well as diabetes, of course. But
yeah, it's a medication that is commonly prescribed to people with type 2 diabetes.
Yeah, and there are studies showing that people who were on metformin who had ovarian cancer specifically, I can remember a study showing that people who happened to be taking metformin had better outcomes.
And I think some people were looking at it as well with breast cancer.
Mm-hmm.
But yeah, so those are some medications that I commonly think of, mostly the proton pump inhibitors, you know, the acid blockers, as the kids say, and metformin. Those are the big ones.
Yeah.
And aging, I mean, just aging in itself, that's not a medication, but, you know, just getting older and having decreased absorption,
Mm-hmm.
you know, changes in diet from aging. The big thing that is kind of controllable is alcohol. And one of the things that I found in my vast research is that heavy consumption of alcohol for over 2 weeks can cause a deficiency in B12.
Interesting. So basically, partying like a rock star for a couple weeks will do it.
Yeah, like a couple of weeks of spring. I don't know. Spring break is how long? I don't know. Just blame it on spring break. But yeah, partying like a rock star for, 2 weeks plus. Not to say that you should just party for a rock star, like don't limit it to 1 week, but I think that's pretty dramatic. Limit your rock star partying to 1 week at a time. Yeah. And then other things that could affect the absorption, we kind of touched on pernicious anemia, any surgeries that would affect
Mm-hmm.
your stomach or your small intestine.
Yes.
Definitely. And I guess we should kind of point out that, well, we did before, like the liver is really the main storage place for B12. And so any sort of liver disease might also affect B12 storage.
Yeah. My understanding is that the liver can store about 6 months worth of B12. So, if you're on a desert island and not able to get B12, you've got about 6 months till it tanks and you need to start eating the animals on the island.
Which may be your travel partners. No.
Hey, that's gross.
I was thinking shellfish. And then somehow Lost came into my head. I never saw Lost, but Gilligan's Island. They never ate each other.
No. There was a lot of coconuts. So the other thing is family history. So if you do have, especially parents, grandparents that had B12 deficiency, you do need to, pursue the workup to make sure you didn't inherit some autoimmune condition. I did have, true story, I had one patient with depression and an overall lack of motivation. I mean, he powered through every day. It was his wife that dragged him in to see me back in the day. And his B12, his serum B12 was low. Now, if your serum B12 is low, you're pretty tanked. So we did do an autoimmune profile, and sure enough, he had antibodies that his body was making that were attacking his own parietal cells. And those are the cells in the stomach that make intrinsic factor. Intrinsic factor is necessary to absorb the B12. So, yeah, it was the only case that I had of it that was autoimmune in nature. Usually we're looking at, deficiency due to other reasons within cancer care.
Well, celiac would be another autoimmune condition that would affect the absorption. And then I didn't mention the big one that I'm sure that you've seen all the time. I'm being smart here. I didn't mention, now I'm thinking of the Natural History Museum in New York, with that giant tapeworm. People with a tapeworm can have B12 deficiencies. Did you ever see that in New York? Did you ever see that giant tapeworm that's wrapped around the ceiling? Probably pretty much. It's disgusting.
No.
Yeah.
Huh.
It was at the museum.
So we talked about the risk factors. So we have family history, problems with the GI tract, whether it's post-surgical or chronic issues with the stomach or intestines. That could be celiac disease. It could be chronic gastritis. There's a lot of medications that can interfere. And then we had vegans in particular, but maybe vegetarians to an extent.
Right.
If they're not eating well.
Right.
And the signs and symptoms look a lot like all the other anemias.
Yeah. So the one that I always find is fascinating is that glossitis, the really smooth tongue, smooth, shiny, kind of red tongue.
Yeah, which is indicative of B12, and a couple other B vitamins can show up that way as well, where the tongue is larger, redder, maybe shinier, losing its papilla.
Yeah. And then the other one where I've seen is those kind of neurological symptoms, neuropathies.
Yeah. And the reason B12 shows up with neuropathy in particular is it's necessary for the health and the creation of the myelin sheath around the nerves. And so the sheath around a nerve is just like the covering on an electrical wire, the rubber covering around the actual metal wires. It's analogous to that. So without that, the electrons don't flow normally down the wire. So the myelin sheath has to be intact, and B12 deficiency ultimately affects the health of your myelin sheath. And then the rest of the symptoms are pretty generic for anemia. So it's fatigue, pallor or paleness of the skin, and mucous membranes. So our mucous membranes, you can look at your gums, and if they look pale, you look at the conjunctiva, which is, the part just in the eye where you get conjunctivitis or
the pink of the eye.
Yeah, the pink of your eye. You can look at that, and if it looks pale, so mucous membranes will show it before your skin does.
But it's not specific. What you're saying is it's not specific to B12. It's just showing there's some sort of anemia going on.
Correct. Anemia is a generic term for just not getting enough of the oxygen to the tissue. And there's many different types of anemia. And you use the term pernicious anemia, which is a B12-driven anemia. And it's also called megaloblastic anemia. And the reason it has the name megaloblastic is on your labs, there is a parameter that talks about the size of your red blood cells. And if your red blood cells are large, then they're considered megaloblastic. They're large. This parameter is called MCV. So anyone who gets a CBC, which stands for complete blood count, underneath your hemoglobin and the number of red blood cells, you'll see a bunch of other parameters. They all have to do with the health of your red blood cells and what they look like. Ultimately, what they look like under a microscope. I mean, we run it through machines today. We're not looking at them under a microscope for the most part, but when they're large, that MCV stands for mean corpuscular volume. Corpuscular just means red blood cells. Mean volume of the red blood cells. If that's high, over 100, There are a few things that could be happening. B12 deficiency is one of those things. Folate deficiency is another. And the most common reason for high MCV when people are going through chemotherapy treatment is that those are baby red blood cells. That's not a problem. It's totally normal. When red blood cells are first formed, they're called reticulocytes, and they're big and round, and their volume is higher than a normal mature red blood cell. So a high MCV, 8 out of 10 times, I would say, on a lab of someone who's getting chemotherapy just means they're making new red blood cells, and it's perfectly normal compensation of the body. It needs to churn out new red blood cells.
I think we've mentioned before is that when red blood cells are first made, we may have mentioned this in folate, they're really big.
Chubby.
I think of like Baby Huey. Remember that cartoon? Baby Huey, a little giant chicken who was a baby.
No.
It was giant. Well, so when red blood cells are first made, they're Baby Huey. They're big. And then things like folate and B12 help them to mature. And then they go out into the world and they're smaller. Mm-hmm. So that's how I think of it. Baby Huey.
All right.
We'll put a link in our show notes so people can see.
To Baby Huey.
To Baby Huey. So, and I think that's a really good way to introduce like what is B12 used for. So you mentioned myelin sheath, you mentioned formation of red blood cells. I mean, there are so many different things that B12 is involved in. We may have touched on it. Did we talk about it in the melatonin episode? Because of the melatonin serotonin pathway, you need B12.
I think you mentioned it. Yeah.
I think I mentioned it and I said I was going to put a diagram, and I don't think I ever supplied you with a diagram. So I don't think it ever made it. Let's see if we can make a note to do a diagram this time.
So, and I just want to make sure that for signs and symptoms, because B12 is so involved in so many things, I just want to, before we move on to the next topic, depression is high on the list too, because of what you're saying right now, which is it's involved in that serotonin, melatonin pathway. And because it's involved in neurotransmitters, its deficiency can cause lack of those neurotransmitters.
I worked with an integrative psychiatrist previously, and he would recommend both B12 and folic acid to patients to help their psych meds work better.
Okay.
So I thought that was kind of interesting. Oh, you know what? God, all over the place this episode. Birth control pills can also lead to deficiencies in B vitamins, such as B12.
Yes.
But don't start taking it willy-nilly. Had to throw that in there. Okay, so I don't even know where we left off.
I don't know. Let me summarize signs and symptoms though, because I do feel like we're all over the place. So we have paleness of the skin, fatigue, depression, neuropathy, general weakness, disinterest, enlarged tongue, red tongue. You can have nausea, vomiting, and you can have some loss of appetite for some people, but that's pretty severe. And in my own experience, it goes from pallor to almost a greenish hue of the skin, just so you know.
Oh, interesting.
Mm-hmm. Yeah, there's a hue that the skin takes on when people are deficient. That's in anemia in general. Anemia can give almost a greenish pallor. And that's just the lack of the oxygen making it to the surface.
So one of the many controversial things about B12 is how much should people even be taking?
That is controversial. Because
what we need, or the recommended daily allowance, is a pretty low amount. Like it's typically in supplements as like 1,000 micrograms.
Mm-hmm.
But that's not what our body needs. And then if you factor into how much of that is being absorbed from the food itself, I don't know. It got very, very complicated when I was trying to find what's the recommended dose.
Yeah, it's not very much compared to what any supplement has, like you said. So I don't know. I don't pay too much attention to the recommended dose because it's so low that it seems a little bit too low.
Yeah, I mean, like I'm comfortable with about 250 micrograms a day for somebody who's vegan, say.
Mm-hmm.
Right?
And are you qualifying that with like a sublingual form so you know it's making it into their system?
Yeah. Yeah, well, like a chewable or a sublingual. Yeah.
Yeah.
But you can't really find supplements that are in that amount.
Mm-mm. No, and because we do store it, I mean, one option is to take a higher dose, like 1,000 micrograms under the tongue, and do that 3 times a week.
Yeah, I've seen where like on like vegan sites, they recommend doing that like once a week. But I guess it depends what's going on if you're trying to replete versus supplement, you know?
Mm-hmm.
But yeah, it's not something that needs to be taken every day unless you have like a, you know, a frank deficiency, or, I mean, I had patients who had their stomachs removed and they would need to get like, in the muscle, like they'd have to get an injection of B12 regularly. I think it was monthly.
Yeah, I'm always interested in that because I'm wondering why the injection has to happen when sublingual should bypass the stomach altogether. But I've had that happen too, where people couldn't be repleted until they got the injection. So that doesn't add up completely, but
I don't know. You could bill insurance for the for the shot, for the injection. That's my guess. Okay, so
I wish I could say that was untrue, but you're probably right.
So the recommended dose based on, what does Linus Pauling website say versus what you find out in the wild, in the supplement world. It's kind of up in the air. Do I think somebody should take 2,500 to 5,000 micrograms a day sublingual? No, I think that's a lot.
Yeah, I would say 1,000 a day is still within my bounds of, okay, that sounds okay to me. Most people, here's the thing with compliance, and myself included, doing something twice a week or 3 times a week is just not going to happen. If it's not an everyday thing.
Well, that's why I like the idea of doing like, once a week.
Yeah, even that.
Every Sunday. Remember, that's your day to take your B12.
I wish that would work in my brain. First, I have to realize that it's Sunday. I could go an entire day and be like, what is today again? So.
That's why we have alarms in our phones.
Now that I could do. If I could, put it in my phone to remind me. But realistically, compliance is key in our medicine, right? So like for me, when I talk to patients, I'll tell you right now that generally speaking, throughout my career, when people do what I ask, it works better. So just speaking from experience, whenever I had someone, split up their high dose vitamin D because they were taking some mega dose, like 50,000 IU they had in their capsule, I was like, no, don't do that every day. Oh my gosh, please just take that once a week. They would forget, or they'd put it, it'd make its way to the back of their cabinet or something. And so, compliance.
This would be a perfect time if they were a sponsor. Those labels I told you about, Take, where like there are these little stickers that you put on your pill bottles, supplements or whatever to remind you when to take it. See, I feel like this would be like when we would segue into a commercial for Take.
So we would do something like, when I have a supplement I want to take at home just once a week, I use Take.
Exactly.
Uh-huh.
Yeah.
Do we like deviate from our normal tone and do the...
Oh, you have to do the commercial voice.
Now a word from our sponsor.
I do like that product. I haven't used it for myself, but I love the idea of the product because, Anyways.
Can I throw a random... Well...
Can you throw a random thing in? Sure, because I've been doing it.
We're sitting here, we're talking about B12, we're talking about cobalamin, and I want to just say, you're going to read in the first sentence out there when you Google cobalamin or B12 that it's a coenzyme. And I don't know how many people's brains go, the brakes get turned on. They're like, I don't even know what a coenzyme is. So I just want to say, all vitamins that we talk about, especially all these B vitamins, I should say all water-soluble vitamins, are coenzymes. They are a molecule that is necessary for an enzyme to work. So it's a coenzyme. It's not the enzyme. An enzyme is a protein that causes a reaction to go forward, but that enzyme, that protein, needs its coenzymes, and each enzyme has its own coenzymes. So this could be many nutrients that we talk about. In this particular case, the coenzyme is B12. So I'm saying this because I think, the word enzyme is even confusing for some folks. I just wanted to break that down because it's a coenzyme. It means that without it, many enzymes in the body will not function. The ones that depend on this particular coenzyme, B12.
I think that's a really good place to also talk about what are these different forms of B12? Because depending on what you read, cyanocobalamin is the form that you should be taking. And others will say, no, you need to take methylcobalamin. And there are other forms as well. And when your body takes in B12 from food, it kind of like splits it apart into the methylcobalamin and the, is it
Adenylyl
cobalamin. And those are used for different things. One's used for blood formation, one's used for, nerve or whatever. So I think that is something else that's really confusing to people. But there's no consensus as to what is the best form to take.
No, there's not consensus. And it's a little bit, I think of it a little bit like we think of minerals in that it's not alone. So you don't take cobalamin, like you said, you take methylcobalamin or cyanocobalamin. And when it hits the stomach acid, it detaches from whatever it's attached to. So now you've got a methyl and a cobalamin, or you've got the cyano and then the cobalamin. So you've got two pieces of a molecule that gets broken. The question becomes not just what does the cobalamin do, because we know it goes on to get absorbed as long as there's intrinsic factor and everything is normal in absorption in the gut. What happens to that other molecule? Do you need that methyl group? What is the cyano group going to do? Do you just pee it out? So it's a lot like when we talk about minerals being attached to something like magnesium malate, magnesium citrate,
oxide,
magnesium oxide. Right. What is happening to these two different molecules? You have the nutrient and then you have what it's attached to. And usually what it's attached to has to do with convenience. In the case of B12, cyano is the most stable. So cyanocobalamin is common over the counter and even in injectable form. It's the most shelf stable. The other forms are much more volatile, so they go bad more quickly. And I don't think there's any proof that cyano molecule that there's any detriment to it, because we're talking about very small amounts, like micrograms.
Yeah, because that's out there in the internet world that, so cyanocobalamin has cyanide in it,
Exactly. Yeah, I think that's overblown. I don't think there's enough in there to amount to anything. And there's also the idea that a small amount of certain things, even a smaller amount of radiation right now on the planet, we are all sitting here with a very small amount of radiation going through us, and a small amount may just be part of life, right? This hormesis, it's called hormesis effect, where low dose has one effect and super high doses have an opposite effect. So radiation, while it's necessary for life, too much of it is obviously lethal or cancer causing or whatever. So I think of the cyano molecule kind of along those lines, like, there's so little in there, it probably doesn't do anything. Who knows what it does? Because there's a little, cyanide and other things that we put in our mouths. So I don't have any problem with cyanocobalamin as a supplement.
The other important thing I think to point out is that for people who just start randomly taking vitamin B12 as a supplement, is that folate deficiency can also present itself very similarly. And so that is why a lot of the times you will see those two being given together as a supplement in, the store, wherever those often travel together, because by taking one supplement over the other, you could be masking a deficiency in the other one.
Yeah.
But then that gets into the whole, do you supplement with folate? And that we did a whole episode on that. That's why I don't like B12. It's so complicated. Should we get into where it truly becomes complicated in the world of cancer? Should we take a break and then come back and talk about that? Did we have anything to cover before we?
You're talking me out of even talking about it because you're saying it's complicated.
It is complicated, don't you think? And we're not even going into the whole, MTHFR, oh my gosh, that's where it really gets complicated. We're not even going there.
Yeah. So there are a few points within the realm of cancer care, besides the idea of some of these deficiency syndromes where there are times you probably shouldn't be taking huge doses.
So do we break and then come back?
Yeah, let's take a break. Then we'll talk about it.
Now get our thoughts together.
Compose ourselves.
Let's compose ourselves. We'll be back
right after this.
B12 and cancer. We're back. This is what the folks are here to hear all about.
I know, right? Sorry to leave this to the last minute, but you had to have all the other information first in order to understand the context of this, I think.
I think so. So I think a good way to ease in is that in some people, a B12 deficiency can mask signs of something like polycythemia vera. If somebody takes a lot of B12, that can kind of unmask them having polycythemia vera. So there are these conditions where, B12 kind of plays a role in a way.
Yeah. I came across a paper, I think it was 2021, and it talked about elevated B12 on labs and reasons for that besides cancer.
Or besides supplementation.
Besides supplementation. And I think that's what you're talking about when you say masking. So if you take it and they see high B12, is that what you're saying? When you take high B12 as a supplement and you have an underlying condition, you could be masking that condition?
Yeah. Somebody could have a B12 deficiency due to a condition like polycythemia vera, and then they start taking high doses, and then, because you need that methylmalonic acid. If you have your lab shows high B12, which with people supplementing, it often does, they'll run another lab, the methylmalonic acid, which actually shows if there is a true deficiency.
Yes. MMA.
Yeah.
MMA picks up a deficiency in vitamin B12 in a much more sensitive fashion than serum B12, which is a pretty gross measure.
So there have been some studies recently that talk about people who supplement with certain B vitamins, such as B12, may have an increased risk of certain cancers. Lung cancer was the big one that came out.
Yeah, this speaks to that it was a correlation study. So
right,
it was correlated. So people who took B12 were more likely to be diagnosed with lung cancer, but people diagnosed with lung cancer probably have a symptom of fatigue beforehand, or could very well have fatigue beforehand as one of their symptoms, and elect to take B12 because they feel fatigued. And that's what you do.
Right. We talked about that. We talked about how with these correlation studies, correlation does not imply that's the true cause, right? Is it a coincidence that these people who are being diagnosed with lung cancer just happen to be taking some sort of a vitamin to help them with whatever it is, energy or just, overall wellness, right? Like, I smoke, so I'm going to take some vitamins to balance out the bad effects of smoking. Yeah. So, but I still am very cautious in patients who have lung cancer or just solid tumors in general.
Yeah.
With B12 supplementation.
Well, that's I think good reason. I think that we are both cautious with solid tumors in particular because there was a couple studies that looked at national registries. One was in a British National Health Registry, and the other was the Netherlands. Yeah, it was in the Netherlands, National Health Registry. And National Health Registries, for those in the United States where we don't have anything like this, they track everything people are doing within the socialized medicine system. So if we were living in one of these countries, they would know all of our health history, including all of our diagnoses, all of our medications, what we end up dying of eventually. So these health registries have seen associations between high B12 on labs and solid tumors. And in particular, those tumors were pancreatic, bladder, colon and rectum, lungs, and prostate. And so high serum B12 has been associated with those. And there was a study not long ago that looked at these two registries and actually said, okay, is there other confounding factors? Are we just picking up something that's not real? So they adjusted for other causes of B12 being high in the blood. So the other causes were things like acute or chronic liver disease can cause high B12 in the blood. Chronic kidney failure can cause high B12. inflammatory conditions, including autoimmune conditions, can cause high B12. And of course, taking too much B12 supplement, which is easy to do, can cause high B12 on a lab. And it's also known with some blood dyscrasias or blood malignancies. So correcting for all of that. So saying, okay, that person had one of these things going on, so we don't count that person. Even when you removed all the other causes of high B12 in the blood, there was still a strong correlation with the presence of solid cancers, and even more so, a much higher correlation with solid tumors that had metastasized. So metastatic cancers were much higher, like 4 times more likely when the serum B12 was high.
So is high serum B12 outside of supplementation a marker, for cancer?
Right? That's a logical question. That is exactly what is being looked at now. There was another paper that followed this one that said, should we screen serum B12 as a screening tool and say, okay, if it's, whatever the cutoff would be. When they said high, they specifically in that national registry one that I just mentioned in 2021, the cutoff was greater than 1,000 nanograms per liter. That was the serum B12 level on the labs that they used as qualifying as a high level. So yeah, that's a high level, but it's not unseen. I've seen levels much higher. Of course, I work in oncology, so it's not surprising that I see high B12 in people who aren't even taking it, because it does happen quite a bit with solid tumors. So yeah, should we use it as a screening tool? Like if B12 is over 1,000 and someone's not taking a supplement, do we then say, okay, we need to look for a solid tumor in this person? I mean, that's a really valid question. I think it's being looked at right now as we speak.
I think a really important thing to bring up, especially if we have listeners who have undergone treatment for lung cancer, is there are certain medications that are given where you will actually receive B12. You'll receive folic acid and B12. Pemetrexed, Alimta is the one that I think of. And so I don't want anyone to be like, wait a minute, B12 and lung cancer, but my doctor is giving me this injection. That's different. That's part of the treatment, because Alimta can cause folate. It's an antifolate, so it can cause a deficiency. So the B12 and folate are part of that treatment.
Right. Good point.
Because I do work with an oncologist who will take their patients off of B12, and they also work with lung cancer patients. And so then they're giving them the IM, and I'm like, how is he explaining this to them? Like, wait, okay, you can't take your B12, but I'm going to give you B12.
Right.
So I'm sure there's some explanation that goes on there, but I just thought I would put that out there too.
Yeah. Well, and this correlation, this serum B12 correlation with solid tumors, and in particular metastatic solid tumors, is the reason that you and I are so conservative about giving a lot of B12 to people. What we do not know is why this is happening.
Right.
There is no great explanation to say, oh, that B12 is high in the serum because fill in the blank. We don't know what's going on. So is this something that the body is doing as it fights the cancer? Is this something the cancer is doing and it's to its advantage? Honestly, there is no good answer to this. There's speculation, but there is nothing that says whether this is actually good or bad as far as a person with a cancer who's trying to fight that tumor back with their own body, right? When they did these correlations, these are health registries. So these people went on to have diagnoses of cancer. Sometimes it wasn't known at the time of the high serum B12. It predates the actual diagnosis of cancer. That's the beauty of health registries.
Yeah, it was like up to a year, right? It was like a year.
Yeah, I don't remember, but okay.
I thought I saw one of them. It was in England. And it could predate a diagnosis by up to a year.
Yeah. Why it happens, we don't know. That's why we don't fool around with it. So if you have cancer, so I think you and I agree, Leah, if you have a solid tumor, you have a metastatic cancer currently, or you're at risk of recurrence, so there could be cancer in your body and you don't know it yet, lay low on the B12, get enough, but not more than enough. Maybe go ahead and have it tested in your bloodstream once a year and make sure you have adequate levels. But don't go thinking that no dose is too high because of the big question mark in how B12 and cancer interact and whether these high levels are a good thing or a bad thing. We don't know.
Right, because there are a lot of patients out there, like we mentioned, who take the acid blocking medications and metformin, and they have advanced cancer. And so, there's a balance in how much you can take. If you can find a lozenge that can be broken up, and that way you're getting your 250 micrograms, a day, if you prefer to take things daily, if you want to take things once a week, but I would highly recommend against doing the 2,500, the 5,000 micrograms daily.
Yeah. Yeah. So adequate, but not more than adequate levels is what you're looking for. And generally speaking, many people can go to the doctor and say, can you just tack on a serum B12? And the doc will do it. No problem. Whether it's your oncologist or your primary care physician, do that by all means. If you get thwarted and they say no, because I see no reason for it, which could happen. There are places online where you can order your own labs. So there's quite a few companies online. So just look up self-testing for labs. I tend to send people to Life Extension because they use LabCorp, a very large center.
But do they automatically reflex to a methylmalonic acid if it's high?
Well, we don't need that for this scenario. All we need to know is if the B12 is over or under 1,000 nanograms per liter.
Yeah, but if you're supplementing daily, it's going to be, if you're supplementing with B12.
Right. The goal is to supplement at a level that is adequate, but not more than that. So you still would want to test it and see that you're not over 1,000.
So complicated.
It's nuanced. How's that?
It's nuanced. There you go.
I don't think it was complicated as much as I find it to be one of the more nuanced vitamins. Because complicated has a negative connotation in my mind. Like
it's complex. It's
complex.
It's complex.
Which makes it intriguing if you're into this kind of thing.
Right. So if you're into this kind of thing, this discussion on supplements, you got to stick around because we're going to do one more episode on supplements for this pod. We'll do more. Y'all don't worry. We're going to talk about more stuff. If you want a particular supplement addressed, just shoot us a note. You can email us at thecancerpod@gmail.com. You can send us a message through Instagram. You can send us a message through Facebook. I may not see it, but you can do it.
And if you didn't know this already, this is our Supplements 101 series. So go back and listen to the basics, which was episode 20. And we have already done folate, vitamin D, curcumin, vitamin C, collagen, melatonin, omega-3 fatty acids, glutamine, and mushrooms. So go back, look for those episodes, shoot us a line on Instagram, Facebook, or our email.
Don't do Facebook. I never read our Facebook comments or messages.
All right, don't do Facebook then.
And listening to the list of the things we've done, I think we maybe doing some herbal supplements might be kind of fun for the people. Remember to leave us a review, rating, episodes. Oh my God, what is the stuff that we always say at the end?
Don't forget to rate, review.
That's it. Don't forget to rate and review.
Or follow.
Always follow, subscribe, and buy us a coffee. We need to shout out to Morgan. Thank you for buying us a coffee.
Thank you, Morgan.
If you buy us a coffee, we're going to just say hi and thank you on the air because we appreciate it.
Yeah, she bought us 3 cups. So that means there's one for you, one for me, one for her.
Nice. We're having coffee together. I actually am having coffee.
We're having coffee together.
On that note, I'm Dr. Leah Sherman.
And I'm Dr. Tina Kaiser.
And this is the Cancer Pod.
Until next time.
Thanks for listening to the Cancer Pod. Remember to subscribe, review, and rate us wherever you get your podcasts. Follow us on social media for updates. And as always, this is not medical advice. These are our opinions. Talk to your doctor before changing anything related to your treatment plan. The Cancer Pod is hosted by me, Dr. Leah Sherman, and by Dr. Tina Kaiser. Music is by Kevin MacLeod. See you next time.
Grass-fed liver extract injectables.
Bison. It's bison,
Bison. Yeah, sure.
Bison liver extract.
Right?
Okay, I'm confused.